everyone! Today, we'll dive into the fascinating world of angiotensin-converting enzyme ACE inhibitors, a crucial medication for managing various cardiovascular conditions. What are ACE inhibitors? Imagine a tiny enzyme called angiotensin-converting enzyme, the bad guy in our story. It converts angiotensin 1 into potent angiotensin 2, causing blood vessels to constrict and blood pressure to rise. ACE inhibitors, like superheroes, block this conversion and lower aldosterone levels in the body at the same time. All these actions lead to wider blood vessels, allowing blood to flow more efficiently and lowering blood pressure. Reduced workload on the heart. Less pressure lowers the heart's workload. Decreased fluid volume. Bye-bye, unwanted swelling. You can quickly identify an ACE inhibitor by its suffix. They all end in PRIL. For example, benazpril, captopril, enalapril, fosinopril, lisinopril, quinapril, and ramipril. Common conditions treated by ACE inhibitors include hypertension, high blood pressure. This is the OG use of ACE inhibitors. Heart failure makes the heart work more efficiently. Diabetic nephropathy protects kidneys from damage in diabetes. Post-myocardial infarction, heart attack, helps prevent future problems. How are ACE inhibitors administered? ACE inhibitors are given orally, by mouth, and intravenously. Let's speak about the side effects. You can easily remember the side effects of ACE inhibitors as ACE. Angioedema, cough, and excess potassium. Let's discuss angioedema. Angioedema is an adverse effect characterized by swelling of the lips, eyes, and throat, which is like an anaphylactic reaction. If the client develops angioedema, the medication must be discontinued and replaced with an alternative to prevent swelling that could eventually occlude the airway and interrupt breathing. Dry cough, the most common side effect, usually disappears with time. Excess potassium. However, the client can also experience dizziness due to sudden blood pressure changes, orthostatic hypotension, fatigue. This may happen as the body adjusts to lower blood pressure. Kidney problems. Monitor kidney function closely. We are looking at the BN and creatinine levels. Now let's discuss some nursing considerations. The nurse must monitor the client's vital signs, looking for changes in blood pressure. ACE inhibitors affect blood pressure but do not directly affect the heart rate. Assess for side effects, especially angioedema, as it's dangerous and life-threatening. Monitor kidney function. The kidneys excrete ACE inhibitors, which can worsen kidney failure or cause kidney impairment. Check BUN and creatinine. Monitor potassium levels regularly. Potassium levels should be between 3.5 to 5. Remember, potassium affects the muscles, and the heart is a muscle. So too little or too much potassium can lead to cardiac problems. Educate the client that ACE inhibitors are teratogenic, so they should be avoided during pregnancy and breastfeeding. Finally, let's discuss client education. We are going to educate clients on the following: the medication's purpose, side effects, and importance of taking the medication as prescribed. Educate the client to avoid high potassium foods and salt substitutes. Salt substitutes contain potassium, and ACE inhibitors increase potassium. Too much potassium is terrible for the client's heart and can lead to deadly arrhythmias. Educate the client to not abruptly stop taking this medication. It needs to be tapered. Abruptly stopping taking ACE inhibitors can lead to rebound hypertension. We also want to educate clients to change positions slowly. We want the clients to sit on the side of the bed for a few minutes before standing. This is due to orthostatic hypertension, which causes an abrupt drop in blood pressure when the client changes position from sitting to standing. Educate the client to contact the HCP if pregnancy is suspected, because ACE inhibitors are teratogenic. By understanding ACE inhibitors and their implications, you'll be well equipped to provide safe and effective care to patients with various cardiovascular conditions. Bye, for now, future nurses.